What are you guys doing there at Medicalchain to look at helping the NHS as partners and consultants to improve it more as well?
So, like all healthcare systems around the world, the NHS is not on its own. There are lots of flaws and lots of inefficiencies that can always be improved and updated every few years. The main thing that we have found at this moment for the next kind of 2 to 3 years' time is that there isn't enough communication between doctors and other clinicians, and between those clinicians and the patient. So that's a key, and that inefficiency is causing a lot of loss of money and loss of time and loss of appointments. We have a lack of doctors and nurses at presently, and if we waste those resources by not sending the letters out appropriately to patients, by not faxing them, can you believe we still use fax machines in the NHS? Patients get lost. I mean, I had a patient just last week that has been delayed to have his biopsy for cancer by 6 months because his letter didn't arrive.
Yeah.
And this day and age, we just cannot accept that anymore. We have to find a solution because every life matters, and that poor patient is going to have such a dramatic effect to his health now because of a simple clerical error. So the way we want to help the NHS is by making their clerical and administrative system more productive and more efficient. Kind of cut out the middleman, cut out all the necessities for making phone calls, doing fax machines, repeating the same information repetitively by specialists, by GP, by physiotherapists. We want to kind of put it on one sheet of paper or in a digital format that the patient can access, all the clinicians can access, and we can all work together to get the best outcome for the patient.
When will we see the time when the NHS will be solely all digital, or do you reckon there'll never be a time when that
I think
will
that there has to be a time for it, and I think the only time we can have that change is on two fronts: when the patients demand it, and that we follow normally what the patient's demand is. So if the patients want it, we will do it, and also if policymakers can appreciate the massive difference it will make in the economy of the NHS and how much billions of pounds they are going to be able to save, and so that we don't have to keep cutting services, but instead we'll make the system more productive, then we'll get a change. Both ends, patients, policymakers, the doctors are ready to do that anyway.